For a new patient, and I see 3 to 5 at least every week, new patient with lung cancer, they come in and of course they're scared. They've heard only horrendous things for the most part. So I basically say, take it a step at a time, and at each point, we look and, first we have to proceed in an orderly manner, most situations, to, appropriately stage and evaluate what the patient should get as initial treatment, and we always discuss things, and I just tell them take it one step at a time, and let me look down the chessboard. That's what my training is for, and try to avoid the internet because that's filled with misinformation and problems, and if you start to try to think of every conceivable possibility, you can drive yourself crazy, and so I think that works pretty well for most folks. We try to just make them understand we're thinking ahead, and for them it's just take it a step at a time. So even, for example, where you have potential curative therapies in stage 3, where you're going from chemoradiotherapy to immunotherapy, and there are various stages during this where you're going to do stuff, or trials that are available, is to say, okay, let's just take each section separately, and we'll talk about that one and then move on to the other, because it can be pretty overwhelming for folks. I mean, I think sometimes we forget, that this is something we're doing every day, but for these people, it's a once in a lifetime experience.